Go through once more how the ACA treats small businesses and workers differently than those who self-insure?
The small businesses that insure their employers buy plans from insurance companies, and then they have to, let's say, they go into a marketplace and buy them. Larger companies that self-insure, and well, as the term suggests, protect themselves from the risks that come.
So they protect themselves from the risk. You imply that there is a risk of going into the regulated market. Your testimony emphasizes the increased cost that comes with going into the ACA regulated market. Fair statement?
Well, there'll be cost increases on both sides, right? If you're self-insuring, there'll be cost increases under the Affordable Care Act as well. There's a reinsurance fee. There's
the taxes, the $1 trillion in taxes coming down to individual policy. But it strikes me that in general, the cost increases under the mandated benefits, et cetera, in the non-ACA market, if you will
be more limited.
Yeah.
Yeah, I think that's fair.
So if you will, the cost increases will be greater upon the smaller employer, the one who's not self-insuring.
I think that's certainly fair to say.
So the smaller employer who typically, let's face it, they're smaller, they're trying to get big, they're the ones getting hammered the most. Isn't that crazy?
Yeah, perhaps with the exception of microbrews that want to stay small for some reason. I think that's also fair to say.
Yeah. So if you will, it's interesting, the CBO recently put out a study saying that they have lowered the cost of coverage because there will be wage reductions under Obamacare, so therefore fewer will be on subsidies and more will be on Medicaid. You almost wonder if this was by design. Again, you don't have to comment on that. That was CBO reporting that. Dr. Hauselmeyer, Mr. Hauselmeyer, I'm sorry. One more time. Can you tell us the amount of money which is available through the reinsurance program relative to the size of the market that's going to be in the exchanges?
Yeah. The reinsurance program makes available as much as $10 billion this year. If it's not all used, it can be carried forward.
$10 billion with a B.
$10 billion with a B. The 2013, the aggregate premium for the individual major medical market was about $28 billion.
So it's $28 billion market, and you got a $10 billion subsidy already going.
Right. Now, so if you make various assumptions about increased costs and increased enrollment, okay, let's say you double that market, or you get a $40–50 billion market. That's if lots of people sign up, and
so you have 20% of the potential loss already being covered just through the reinsurance.
Yeah, that's my point. Is if you're looking at a situation where there's this uncertainty, as Dr. Hoadley and I and others have pointed out, there is this uncertainty that insurers didn't know how many people and how sick they'd be and things like that. My point is simply that there is an appropriation already in there. It's in effect designated to that market because it's going to that individual.
And it would actually be allocated in a constitutional fashion as opposed to pushing the envelope. Dr. V, I'm sorry, I messed up. I didn't finish with my conclusion. Mm-hmm. If we're going to say that the problem of the ACA is that it disproportionately increases cost on smaller firms, the ones that we hope grow to be bigger firms, doesn't it seem a reasonable remedy that we allow them to keep their policy if they like? If it's cheaper, for their bottom line, they can stay on the policy which they previously had. If not, they can go into the regulated market.
I think there's certainly something to be said for that, especially given the promises that were made to them when this legislation was presented and when it was approved and when it hadn't been rolled out yet.
Yeah. So if only to ask the president to keep his word that you can keep your policy if you like it, that would be a reasonable way to go.
I think that's fair to say.
Yeah, okay. Well, I inefficiently asked my questions, so I yield back.